don't you tell the people out there a little bit about, first of all, why you came in and some of the revelations and some of the things that you've noticed, like you just told me, with your adjustment. And then what I'd like to do is kind of share with you and show you some of the stuff I'm doing with Josh as to why he's getting some of these results. Go ahead.
All right, so I came in because I had a lot of back pain in my spinal area, and so I came in and got it checked out. And
you also had some issues going on with your shoulder and your collarbone.
My collarbone got whacked out of place in hockey, so I came in. He's been adjusting me, and I was diagnosed with underactive thyroid, and ever since I've been getting adjusted for about a little over a month, I haven't needed to take my pills, but it feel like I've been taking them. So
and you just came to our class.
My energy level has been going up.
So your energy levels up. You just came to our workshop class and started learning a little bit more about how we're not treating the back pain, but we're actually freeing up the nerve. And wherever there's a nerve going, there's a blockage, there's an interference. Okay, so it's like having a dimmer switch to his thyroid. Okay, now what I want you to do is I want you to stand up here. And how long have you been playing hockey?
For about 5 years.
Okay, now turn to the side here and let's just take a look. I just want to show you now what we look for here. Okay, as we're looking at him, we're looking and we're seeing a lot of forward head posture. Now, if we are to measure the center of the shoulder, it should land at the center of his ear right here, and you'll see how forward it is. Now, this is really common when we see patients with thyroid because as the head starts to move forward like this, you're compressing the nerves that are occurring here. You're compressing nerves at what we call the brainstem. Now, the brainstem is the control center for hormones, for the immune system. This is where a lot of people get problems with women with endometriosis. They can have problems with the colon, all these parasympathetic nerves that go all the way down to the lower part of the back. Well, in his case, number one, it's affecting this area, but it's also affecting the thyroid because these nerves can affect the heart, they can affect the lung, they can affect the thyroid. And this is where a lot of times people will get heart racing, skipping beats, fluttering, things like that. Well, in his case, as he played hockey, was it hockey that broke your collarbone here? Whenever you do something like that and break a collarbone, do something like that, it's going to shove the force into the core portion over here. Okay, now if we turn around and let's just look at your back over here, looking straight ahead. Okay, now one of the things we notice is this is the center for his posture, and this is where his neck is. So it's actually translating or shifting over to the side. Once again, putting a lot of pressure on these specific nerves. So we help a lot of patients with thyroid issues. I want to show you kind of what we do in terms of how we would fix forward head and how we would fix a spine. Okay, so let's have you lay face down on the table right here. Just put your head right into the center. Okay. Now the first thing we're going to do is we're going to come up here and we're going to actually work out where the forward head is. So when I take a look at a patient like this, as his head is down, we're going to be lifting this section up, and we know that from his x-rays that his neck does not curve properly, it's too flat. So once again, it's putting too much pressure right here where the thyroid is, okay? So when we make an adjustment, we'll cock the headpiece and we'll drive the neck down in this direction, or we'll take our hand and go straight in because we've got to get this neck adjusted forward to get the curve moving in this direction, okay? And that's going to free up the pressure here and free up the pressure here. Because again, as far as the head's going forward, the more the head is going forward, it's like taking a bowling ball and holding it way out here, and this is working harder, number one, but number two, you're compressing right on the area that controls the whole hormone system. Now in his case, we're going to be working this back, so we'll adjust this way or come in this way and move it back so this opens up that whole area. And then what we're going to do is we're going to work on the specific spots that affect the thyroid. So we're going to turn his head and we're going to adjust it that direction there. A lot of times when people have a forward head, the center of the back is going to bow. So as the head starts to move in this direction, that's why the shoulders start to round, because if you were to push your head forward, you'll feel a lot of strain here. And if you round your shoulder, next thing you'll feel is this strain will go away here. So innately, the body wants to kind of compensate like that. But then that leaves us with a rounded back up here. This is also a reason a lot of people have asthma and things like that. Okay, so we'll actually then move this section and work on this area right in here. Okay, now, low back's good. Let's have you roll over in your back. Now when we're adjusting the spine here, we're going to check the skull to find out which direction it needs to go. And in his case, it has to go this way in terms of the first bone, the neck. And then the next one, we're going to just kind of set the skull down this way. Now have a seat up. Now scoot up. Now here's how when we lift the forward head, we're going to lift this cushion. Now go ahead and lay back and push your head back. Now the adjustment, remember chiropractors don't adjust bones into place. What we're doing is triggering nerves, the fast portion of the nervous system to fire so that that nerve goes to a muscle. And then the patient's going to be doing exercise in a forward head case. A patient will be doing exercise like this, or they'll lay face down on the table and lift their head up, maybe with a weight on their head or just the weight of their head. And you always do it in a holding position. Now with this, what we'll do is we'll actually take and adjust his head backward. So we're going to be doing this. And we'll be triggering that to move backward like this. We'll fire about 3 or 4 of these like this, which are going to fire the nerves to the base of the neck, and it's going to actually trigger him to pull the head all the way back. Secondly, what we're going to do is we're going to adjust his collarbones. Now put your arms up like this and put them in this stick 'em up position. When they put them up in this position, what we're doing here is taking that rounded shoulder and pulling everything back. Because what will happen is, as the head moves forward, the shoulders will start to curve forward and it jams the collarbones, and this affects people's breathing. So what we're going to do here is we're going to adjust these out like this. Did you feel that?
Yeah.
Now sit up, face the camera. Lastly, whenever you turn this way, now let me be behind you. So now last thing what we're going to do, okay, there's a couple of adjustments that we'll do to help forward head. One of them is to set the shoulders back. So again, we want to move them back in this direction. And sometimes we have patients who have a lot of distortion. We'll actually have them lift up this way, and then what we'll do is reach behind them and start to stretch them back. Now look up towards the ceiling.
That feels good.
Yeah, and then what this does, it spreads the rib cage. Because see, part of the problem, and this is why people develop oxygenation problems, they develop breathing problems as time goes on, as the head goes this way, the shoulders roll, the ribs get jammed in here. And the ribs have to move up and down for breathing, okay? So, because the lung has to go right up here in this top portion of the ribs. These are called bucket handle ribs, so it has to be movement here. And when you have forward head, these ribs aren't going to move real well. So, when we do an exercise where the patient will exercise, they'll actually get into a corner, put their arms up like this, and walk into the corner. But now, in order so the forward head isn't being induced, we also have them pull their head back. So whenever you stretch out the front rib cage like that for the forward head, you're also going to be pulling this back. So what nerves are you going to influence? You're going to affect a lot of nerves to the thyroid. So as we start freeing these up, all of a sudden those glands and organs start working, and that's how we correct those. So that's what we do in terms of the chiropractic approach to helping some of the thyroid problems we see.
And I'm super excited because I don't have to take a pill for the rest of my life.
There you go.